fortunate to have with us a professor from Tennessee State University, Professor MKanu2, who is talking about some aspects of President Obama's health plan. And let's see, Dr. Kanu, if you might give us what you might consider to be some of the key elements of Mr. Obama's health plan, and then we'll work from that angle.
Okay, absolutely. First, it's important to put this plan in a proper context. What is it about? The plan is focused on expanding coverage and reducing healthcare costs. It comes, of course, with a very huge price tag. It's always about $76.8 billion for fiscal year 2010. Now, after knowing that, the second important component of that is a reserve fund. This fund is supposed to be there, or is going to be there for a 10-year period at the range of $360 million. This is what is supposed to be used to improve the health of all Americans. But in a very succinct way, in a nutshell, the plan itself has 8 major components. And the first component, of course, talks about speeding up the use of electronic records. You know, this is very, very important. And, you know, if I may just spend 1 second talking about that. The Institute for the Future in the United States talks about how important the use of technology has become when you consider the fact that there's roughly about 33 million hospital admissions in a year, with 505 outpatient visits, and 208 billion prescriptions a year, and 408 billion claims. I mean, how do you process all of that information? You need to have a system that is going to help improve the efficiency of handling all of this information. So when you hear all of this, it makes sense to you why the use of technology becomes a very important aspect of this. The second one is an emphasis on improving research that will compare the effectiveness or the efficiency of medical treatment. And this is underscored by the importance of what is called evidence-based medicine. How do you look at 2 treatments and actually decide which of the 2 is going to give you better outcomes? So again, that's a very key element of this. The third element of this is a doubling of amount of money that is used on cancer research. And the way this is proposed is to inject a significant, I think it's $6 billion in the budget of the NIH, which is the National Institute of Health, so that this research will be expanded. And there are other aspects, and that was the fourth aspect of this, is the recruitment of clinicians. And here we're talking about health professionals such as dentists, nurses, and physicians. Now, improving the numbers is just one thing. The most important thing is actually the distribution. Because sometimes when you look at these numbers, you know, the numbers are there in a lot of ways. But, you know, how many of these people, how many of these professionals are willing to serve in underserved areas, such as rural areas? For example, one study that I read, it's kind of dated now, I think it was published in 1998, talks about having 300, and I think it's 303 physicians serving in usually a very small radius of a metro area.